But the prevalence of many minimally invasive surgery is growing, and the market for its tools is growing as well. Today, it's a $22 billion global market, and it is poised for transformation. Okay, hello. My name is Leah Brownlee. I am the president of Lazurite. I'm sure many of you have had or know somebody that has had minimally invasive surgery. And in all of those surgeries, the surgeon used the camera to allow him or her to see inside the patient's body. These cameras have changed very little since their introduction 50 years ago, and they're still tethered by long power and light cables to the bulky surgical tower. And these cables are a problem. They introduce risks for both the staff and patients into the operating room. They hinder the surgeon's movement and draw his or her attention away from the patient. They cost hospitals and ASCs both time and money to clean and maintain. But the prevalence of many minimally invasive surgery is growing, and the market for its tools is growing as well. Today, it's a $22 billion global market, and it is poised for transformation. This is ArthroFree, the first FDA-cleared wireless surgical camera. The idea for ArthroFree began when our CEO and co-founder witnessed a PA trip and fall over surgical camera wires in an operating room. Not only was she badly injured, the case was canceled and the hospital lost money. But this event triggered a question. Why do we have wireless cameras everywhere in our lives, but we don't have them in our operating rooms? The short answer is that it was hard to make a camera to meet the requirements of the operating room. And many had tried. So why did we succeed? First, our disruptive, patented Meridian light, a new type of light that is more efficient than an LED and is cool to touch. Next, we implemented a military-grade ultra-wideband encrypted wireless protocol to transfer images without any interaction with the customer's IT infrastructure. And last, each of our batteries will last at least 60 minutes and will withstand hundreds of charges and sterilization cycles. We've capitalized on our innovations by filing patents worldwide. Today, we have 13 utility patents granted and 27 pending worldwide. And our regulatory pathway is de-risked. Our approved indications for use cover all types of minimally invasive surgery. But in such a big market, we are laser focused on arthroscopy. The ArthroFree camera is the first commercially available surgical camera to enable wireless video transmission with integrated light and power sources. And it promises to save customers money with ongoing cost per case savings of up to 20% for busy surgery centers. Now, we've set ourselves up for success with our collaborations. We partnered with university hospitals, performed our first surgery at NYU Langone, and recently announced a collaboration with Hospital for Special Surgery. Our sales funnel includes more than 1,000 sales leads, and we're actively conducting clinical evaluations and taking orders. Now, who are we? Lazurite has a small team of experts that has collectively decades of experience in the medtech industry, and we benefit from a professional, industry-leading, and engaged board. Today, we're seeking $7 million of funding for use in building out our sales force, securing our supply chain, and deploying product to customers. The future of minimally invasive surgery is here. Join us.
Leah, thank you so much. Talk to us a little bit more about the moat around what you built. You talked about the patents that you have filed. Obviously, there is a whole industry of surgery medical devices that would ostensibly be hot on your heels to create the next generation of their tools. So talk about the defensibility and the moat around what you've built.
Absolutely. So we have two primary families of patents. The first is around the wireless surgical camera. And that is a pretty simple patent, just describing kind of the basic enablement of creating a wireless camera in the operating room. And that patent is granted worldwide and was filed in 2015, so it'll expire in 2036. The second group of patents is around the light technology, and that light technology enables the wireless camera because it uses so much less energy. But our patent based on that technology is industry agnostic. So it has filings that expire in 2036 to 2038 that are also granted and pending worldwide.
You mentioned in passing your partnerships that have helped you come to market successfully. Tell us a little bit more about those and kind of what makes them unique and special.
Sure. So the first one is University Hospital. So that's in our backyard in Cleveland. And it's about a year and a half old since we enabled this partnership. So we own our own IP, but we've partnered with these hospitals afterward. And with University Hospitals, to date, we have 2 publications that have gone out on the efficiency of our system. And we have more studies pending. But really what it gives us is a lot of access to the doctors that work in our city and the facilities to do those customer need access and to do those studies that we provide to the value analysis committee for the new customers. NYU has been great for surgeries, a lot of work on the image tuning for arthroscopy and initial feedback for product rollout. And HSS is brand new. So what I hope is that by the end of summer, you guys will be watching us on YouTube on the HSS Academy site, and that we'll have active clinical studies going on in their operating rooms.
Tell us how surgeons have responded to this, moving from bulky wires to the wireless device.
So the surgeon response is fantastic, and everybody crosses the span between an early adopter to a late adopter. But what we see is that when we put the camera, and I have one right here, in their hand during surgery, what they really come away with is that the work that we did to balance the camera and make it very ergonomic to hold pays dividends because they walk away and they're not as tired. They're not pulling the wires. And that impacts their ability to do surgery. And then in addition to the surgeons, the surgical staff, the SPD staff, their jobs are easier. It's easier to set up. It's easier to clean, which leads to kind of the lower cost overall.
Is there any pushback? Is there any concern about the battery life, having to change out batteries after 60 minutes, et cetera?
Every new technology comes with pushback, or else it wouldn't be worth it. The hip arthroscopists, their surgeries take longer than 60 minutes very often. So there's a little bit of discussion there. Our battery switch takes about 20 seconds, and our sterilization tray comes packed with 3 batteries in it. So we have had to do battery switches during this, about 100 surgeries that we've done so far with the device. And what we're learning is that, when you train correctly going into the operating room, it's not a problem. People know what to do. We can watch and see what the battery level is and pick a good time during the case to switch a battery if we need to.
Got it. In terms of hospitals or hospital systems, who are you hoping to partner with next?
Well, from a customer basis, the biggest impact is really those busy ASCs. The more cases you do, the more impact it is to your bottom line, that you're not replacing wires, you're not cleaning wires, et cetera. And also just the smaller package when you have a limited space. From a hospital system, as far as who can execute and help us with that value analysis committee, really today we're working on getting HSS off the ground. And all of our studies executed with them. And next up, we're probably looking towards someone like Rothman Institute that's known for orthopedics.